Alright, so in this video I'm going to show you how to use the lactate meter. This is the meter itself. It's a small device, handheld, pretty transportable. They use these lactate strips. You'll see at the bottom there is a silver chip, and then the top there's a little micro tube. The micro tube is where the actual blood will go. It is worth noting that there will be blood in this video, so if that bothers you, maybe turn this one off. So I've selected the participant number in the meter. It's already calibrated. This right here is a lancet. It's used basically to make a little finger prick. If you haven't seen one or used one before, you can use in different spots. I'm going to go ahead and use my thumb for this video. So the first thing you'll see me do is I will be wiping my finger with a alcohol wipe. So I'm wiping in a circle, trying not to drag things that I've already wiped back to the puncture site. You can use other spots other than the thumb. As you saw there, I dried it out by shaking it a little bit. That way it's not as painful, because the alcohol would go into the puncture and burn, and it would also maybe alter our results. Don't go for the center of the thumb. It's thicker there. The skin is just a little bit more worn, so go for a tip usually. So you just click the lancets, makes a little puncture, and then if you pinch, should give a nice little droplet of blood. It's best if the blood stays in little droplets. Sometimes, particularly when you're doing multiple tests, it'll separate. So as you can see, the little micro tube used basically a vacuum to suck the blood into the tube there, and then it's analyzing it. So once you count down, you should get a number. In this case, 3.8. That's pretty high for rest, but I had been doing a little bit of exercise. What you'll do then is you'll take the strip out, and then you'll take that lancet and put it in a sharps container. Hard side, drop it in, and make sure nobody gets hit by the needle again. You can then put a Band-Aid on the thumb. In the case for me here, I'm going to be doing multiple tests, so I wanted to keep my thumb nice and clear. Other things to keep in mind would be that in some tests, particularly when you're not doing it on yourself, it may work best to use earlobes rather than thumbs or fingertips. Particularly in tests where people are active, sometimes the earlobes are easier to access than the fingers will be. But that's a lactate meter test. You can use it for lots of different things, like a lactate threshold, which you'll see in other videos.